The heart is missing, but this is the superior vena cava.
Okay.
And remember, our blood is flowing to the heart like this. So this and this, those are the brachiocephalic veins. From there to there, and from there to there.
Okay.
What forms a brachiocephalic vein is the union of a subclavian vein and an internal carotid. Same over here, subclavian vein, and up in here, there is the internal jugular. And then that forms the brachiocephalic. Here's an external jugular vein lying outside the sternocleidomastoid muscle. Okay, now other veins in here are going to be way posterior. So for example, let's move over here to see the azygos vein. Here's the azygos just to the left of the midline, posterior. And these posterior intercostal veins are coming into it. And then you see it makes this sharp turn right here. And here that azygos is going to go into the superior vena cava. And it does that right at the heart. You want to hand me a heart bottle? Anyone will do.
This one?
Mm-hmm. Okay, so superior vena cava, brachiocephalic, brachiocephalic. These would be the internal jugulars. These are the subclavians. This is the superior vena cava. This vessel right here is the azygos. And now this heart is not made for that model, but you can see it would fit roughly like that, so this would come forward like so. All right, so that's the azygos, and that's over here on the left side, and it goes straight into the inferior vena cava. On the right side, we have the hemiazygos. That's this vein running up and down here.
A big one?
A big blue one. That's receiving posterior intercostal veins from this side. And although you can't really tell it here, blood from that hemiazygos would drain over into the azygos. Then the azygos goes into superior vena cava. All right, so that's most of those veins up there. If we can,
hepatic portal system.
okay, well let's do some more that would be right in here. I think there's anything else we need to do here. Okay, so you know your inferior vena cava. You can identify all of those guys. This is the hepatic portal system that is difficult. And for that, let's go back to the pancreas spleen model. So the spleen is way over here on the left, liver on the right. Let me turn this around posteriorly to see the hepatic portal system. We said that hepatic portal system included a splenic vein. Now that's just as easy as it can be, because coming from there, there's a splenic vein. And that keeps going to here. And right here, it's going to meet up with a superior mesenteric vein. That's the purple one. The red artery is superior mesenteric artery. So right here, splenic vein meets superior mesenteric. That forms the hepatic portal vein. Only other vein we need to look at is this inferior mesenteric, and that's going into the splenic.
And it's also in the liver model. Right?
We can find hepatic portal veins on any liver, but you won't see the things that form it. All right, what else?
Iliac?
Oh, okay, well the situation with the veins are just like the arteries. Common iliac vein and artery, internal iliac vein and artery, external iliac vein and artery, and then just as soon as we pop out onto the thigh, we're going to call them femoral. Now we do need to know a couple of branches off of this femoral vein. We want to know the great saphenous vein. It's that big long one down the medial side of the thigh and leg. And then the popliteal vein, which is coming up from behind the knee. This is popliteal. And there you have it.
Thank you.
You're
So
welcome.
this is the femoral.
That shows up on YouTube. Let me know.
This is femoral.
And this is femoral.
And this is femoral.
See, this is cut
right-
before you get any of these bricks.
So right on the femoral is the great sophrenous vein.
It's the great savage. Now there would be one on this side too. They just didn't show it.
And the polyteal.
You sure you gonna get them on your
Popliteal
It
coming
comes
behind the knee.
behind.